Hey there, I am Dr. Amy King, otherwise known as Dr. Amy, and this podcast is The Most Important Medicine. If you don't know me, I'm a psychologist, trainer, and consultant, and we're here to discuss how talking about trauma and providing a space for physicians and their patients to share experiences is how we will transform medicine. I work with physicians on the daily, and every time we have conversations, and I even hint at the discussion of trauma, I'm met with two things: either intense, compassionate curiosity or a whole lot of skepticism. And that's what we're here for, to make understanding and discussing trauma accessible, and even more important, how to respond to trauma so you feel competent as a provider. Every time you join me, I want you to hear practical information and leave with tangible tools that you can use with your patients today. And today I'm talking to a special guest, Dr. Guy Macpherson. Dr. Macpherson is a clinical psychologist and the host of the well-known podcast, the Trauma Therapist Podcast. He also has a membership called Trauma Therapist 2.0, which we will talk about later. But let's just say he brings together resources for clinicians and therapists of all kinds who are starting out on their trauma-informed journey. Welcome, Guy.
Thank you very much. Excited to be here, honored to be here. And I just want to make one correction. I am not a clinical psychologist.
Okay.
I do have a doctorate in clinical psychology. I was seeing clients for a while, but I'm no longer.
Okay.
I don't want to say just a podcast host.
Oh, well, I appreciate the correction. And you're not just a podcast host. I mean, just so much valuable information that's going out there. Really, you're an educator for all now.
Yeah, no, I appreciate that.
Yeah. Okay, so that's your formal introduction. Why don't you just tell people a little bit more about yourself and what you do now?
Yeah.
Just podcasting.
Yeah. So, man, I was working in a clinic in Northern California, and we were assessing and treating young kids who were showing early signs of psychosis. An amazing experience for me. And it was in that setting and that dynamic and position that I really came to see not only how prevalent trauma was and how kind of unnoticed it was going with therapists, with certainly parents and teachers, but how the word needed to get out. People weren't realizing. I mean, you kind of hinted at it in your intro when you said you're met with skepticism, and that just blew me away. And and that's kind of when I said to myself, literally, I need to help get the word. I want to help get the word out. And I wanted to help inspire and hopefully educate and hopefully inspire other newer clinicians who wanted to get into trauma. And that's when I decided to move out of that, shift out of that, start my own business with the podcast at the helm. And that was it. That was the impetus for me doing this. And yeah.
That's wonderful. And that's actually how I met you. So I was listening to your podcast, to a couple of, if you haven't had a chance yet to listen to Guy's podcast, it's really incredible. And I'll link to it in the show notes here. But really, I was listening to your podcast and you had a little intro for therapists who might want to do their own podcast. And I was like, hey, this guy is speaking to me. So I had been really encouraged to do a podcast, especially in the area of medicine, and get the word out about what trauma is and what it looks like. So let me back up for a minute, because you interview just thousands of people. Can you start for me with your definition of trauma?
Right. I had a feeling you were going to ask me about this question. And it's a really interesting question because, as you know, a lot of people have a lot of different definitions of it, along the spectrum. But for me, really, it is something, an event, series of events that I believe, in defining it, really completely disrupts the nervous system. And some people will say, well, it's something that you can't handle, or it's any kind of stress. And I guess for me, I I'm more on the other end of the other end of the spectrum, where there really is a flooding and overwhelm to the nervous system. I mean, let's face it, neurobiologically, there are shifts in the brain. I mean, things happen such that healing has to take on a very different path and journey. So that's kind of how I define it. And again, this can be interpersonal trauma. This can be that goes over an extended period of time, abuse, as well as singular events.
Yeah.
And the thing that got me, Amy, is, when I was younger, I was bullied, and I didn't realize how much that impacted me, how it really impacted the trajectory of my life, my self-esteem, my confidence. And when I was in that clinic that I referred to earlier, and speaking with parents, and we would go through this questionnaire when we would do these. We would get these calls, referral calls from potential clients. Either that was from their parents, sometimes the actual kid, oftentimes from their teacher. And we would go through this list of questions. And I love doing this because you had to find out what's going on. And 99.9% of the time, there was trauma.
Absolutely.
And a lot of therapists and certainly a lot of parents would be, well, okay, but they weren't in the room when the domestic violence was happening, or they weren't in the room when so-and-so shot the gun, all of this stuff that just really blew me away. And 2 weeks later, when the kid would come in and sit in the waiting room, it would be this little kid just reading a book or holding their stuffed animal, this little, this normal looking kid who had all this crazy stuff happen to them. Anyway.
No, I mean,
yeah.
So you can imagine, for a lot of my audience who are physicians and other healthcare providers, thinking about, you want me to talk about what? Did you want me to talk about that domestic violence, that the gunshot that they heard, whether it's, like you said, an acute episode or long-term trauma? That's pretty scary for them.
Right.
What would you say about that fear of talking about trauma with patients or clients?
Well, I think, if I may, for me, depending on who we're talking to, but before the fear, there's almost an ignorance of what trauma is and what trauma could be. And I think it's important to put it out there that what could be traumatizing for one person certainly isn't going to be traumatizing to someone else. Bullying is a great example. But for a lot of, let's say we're talking to other clinicians here, oftentimes fear comes up because for a couple of reasons. One, trauma, let's say interpersonal violence, is so friggin' scary. I mean, it I think ignites this core in our beings of really how awful humans can be. And there's probably nothing more scary than that. I mean, we don't want to talk about, who wants to talk about it? Who wants to talk about this stuff? And I think even for me, when I went into graduate school, knowing that I wanted to study this, I even had a fear myself of, and my fear was of like talking to kids and hearing what they might say, the possible crazy stories that to me just freaked me out. Now
you were signing up to do it.
And I was signing up to do it. Right.
Yeah.
And I was signing up to do it. Now there's another thing here, and that is the fear of what it brings up in us.
Yes.
And can we take that? Can we sit with that? Can we not just try to talk it away or therapize it away or treat it away, but really oftentimes do what is most needed in that specific situation, which is to be a witness
Mhm.
to that. And
Yes.
that requires of that clinician a lot of things, a lot of exploration, a lot of self-awareness that, quite frankly, a lot of people don't want to do and haven't done.
Mhm. So with my audience, right, physicians, healthcare providers, they do get a little overwhelmed, like talking about trauma, because either they're not sure how to respond to the patient in the room, right, who's sharing a story. Let's say the parents of the child who's being bullied at school, right? And you mentioned that it's potentially changing this child's entire nervous system, how they feel about the world, how they feel about peers. What's one thing you would say to that pediatrician or family practice doctor who's hearing that story for the first time?
Yeah. I think one of the things that's really important to understand is there's a lot of shame that comes with not only experiencing trauma, but uh, talking about it and
Mhm.
sharing it with someone else. Um, the other thing is that there's often a tendency to, well, let me back up. I think a really important thing is how to open the door, how to
Mhm.
allow space for that. I'm going to pause here because that's my alarm. Hang on. I'm going to hang. Can we have to break here for 1 second?
Okay,
Hang on.
that's okay.
Um,
So you were
yeah,
talking about shame.
yeah. What I wanted to say, and I think this is important, is how to create space for people to share about it. And one of the things I think that um, is easy to get caught up in is asking, have you ever been traumatized?
Mhm.
As opposed to, have you ever been in a position where someone's done something to you that you didn't want to have happen? Have you ever felt unsafe? Can you
Yes.
talk about that? Because a lot of times people don't know what trauma is.
Right.
And they automatically think, well, no, I haven't been in war. I haven't been
Mhm.
raped. No, I haven't been traumatized.
Mhm.
And what that does is that allows for people to speak about experiences that fit along a continuum, not just the most extreme thing. But I think also when we hear this, um, really, I think one of the most important things here to do is to be be able to be a human being with that person. And that doesn't necessarily, and this is difficult when you're talking about a clinician or a therapist who's got all this education and all these degrees, and you want to jump in there and you want to, do what's best, and you want to help and you want to treat and you want to cure and all this other stuff. When in reality, and again, I'm generalizing here, people are different, but in reality, people want to know that you are hearing them, that you can listen, that you can take what they have to say. And that requires being able to uh, feel. And I'm not saying uh, just recklessly and without boundaries, self-disclose and melt down. But this is where the art of this comes in, is being able to let that person know that not only are you hearing them, but Jesus, you went through this. My God,
Mhm.
how that to feel.
Mhm.
People people want a human being. They don't want to be met with techniques and interventions and degrees and therapizing, and that's not always easy because it's requiring the therapist or the clinician to have done their own work,
Yeah.
because it's not a matter of when, it's not a matter of if, but when you will be triggered.
That's right. So you said a couple of really important things I want to go back to real quick. One thing you said is you don't have to walk into a room and say, have you been traumatized? What trauma have you experienced? You can ask an open-ended question like, have you experienced difficulty in your life recently? Have you ever witnessed something that felt overwhelming or scary? When you lead with that kind of a question, what do you think it does for the person on the receiving end?
Well, it gives them the opportunity to interpret broadly. It gives them the opportunity. People understand. It's kind of a language, and a universal language, right? Have you ever been scared?
Mhm.
Have you ever felt even uncomfortable? Has there been, or is there anyone in your life who you would say you don't feel comfortable with, or you don't feel safe with?
Mhm.
We can understand this. And yet when you say, have you been traumatized?
Right.
A lot of kids don't know what that means. A lot of people, again, automatically assume it means one of two or three things. So
Well, the
it
other thing I love about this is that when you ask it like that, and you said like it gives them a broad range, you're also really respecting that they know what feels overwhelming for their bodies
right,
and that you don't.
right,
Right? And that what felt scary to you, or if you would have defined trauma for them, it might not have fit. And then they might say, oh, I'm not traumatized then. But if you say, have you felt unsafe?
right,
Now you're respecting their ability to know themselves.
right. And again, too, it also brings the takes the conversation away from kind of a clinical conversation to just being interested in what this person's life is about.
I love
And
that.
that,
That's important. I hope everybody who's listening is hearing that, right? It takes it away from just the clinical, right? Whether you're a physician who's talking to the patient, whether you're a nurse who's taking a history, whether you're an organization, right? People are whole people.
right, right. And when people feel comfortable, their nervous system settles down, and they're
Mm.
able to not just relax, but think more clearly,
Mhm.
which is kind of the antithesis of what trauma does.
Yeah.
But you know, I'll give you a personal example here. A couple months ago, I wanted to get back into my own therapy. So I reached out to my therapist. Unfortunately, she was no longer seeing clients. I was like, oh my man. So she gave me some referrals. I talked to one person, and a really nice person,
Sure.
but they led with these techniques and interventions. And I'm like, can't connect with you. I
Mm-hmm.
don't care. I need a human being,
Yeah.
and it's really interesting, because whatever you are, whatever kind of clinician you are, most often people get into these helping professions because they want to help. They want to most times prevent others from experiencing similar pain, right, that they've
Absolutely.
had.
Mm-hmm.
But what happens is with that is it oftentimes turns into uh, utilizing these interventions.
Mm-hmm.
And look, you get into these fields and you go to school, you get all this training, you have to, and oftentimes you come out chomping at the bit to use these
Use all your
interventions.
techniques. Yeah.
Right, of course. When in reality, it's oftentimes, not always, but oftentimes, people who come into your office,
Mm-hmm.
it takes a lot of courage to come into your office. And most times people need to be heard, to be listened to be witnessed. Yes, with all, you have to have that suitcase of interventions there, and knowing when to use them and integrate them. That's where the skill comes in.
Mm-hmm.
But to be able to witness um, a client, a patient, without rushing to fix or cure or treat is a very powerful exchange. It's a very powerful relationship.
Yeah, it's interesting because over and over and over again, what I hear is that one of the best things we can do in that time is listen, just provide a space. And in fact, I was talking to a physician earlier, and he said, sometimes all the other medicine that I need to do, the lab work, the blood work, the checking in, I'll just do that. He said, I can do all that in online charting, but the being with in the clinical space, just listening is the most important work I do. And I don't think that when you're in school that's what gets taught, right?
Right.
Just the being present.
And it's interesting because, oftentimes when we talk about listening or being present, it's like we say, just listen, or, but there's so much behind that. And the reason why it often is challenging, again, because it really invites, and I want to even say forces, demands of the clinician, of the therapist, to define for themselves what is helping. Why did they get into this field? To help? Okay, define what that means for you. Define what it means to treat, to cure. What was it that encouraged you to get into this field? Because it's more than I just want to help. Oftentimes it's, I want to somehow rewrite my own past, my own trauma. And again, that's shining this light of awareness onto the clinician and inviting them to really explore their own biases, their own fears, and their own triggers.
Well, and you said something else, which is perfect, because I was going to ask you about finding meaning in this work that can be really hard at times. And I love what you said, that it really allows them to define what it meant for them to enter into the field, right? Whether you're a mental health professional, a physician, a nurse, right? Like, you really have to do a deep dive.
Right. It's my belief is that if you don't do that, you will be almost forced to do that, because you'll find yourself kind of trying to fit a square block into a round hole, in a sense, with interventions and techniques. And there's no shortage of interventions and techniques, but when we're in the presence of someone, nurse, doctor, whatever, who is there with us and listening and being present, which means allowing your own stuff to kind of fall away and to be witness to what's transpiring, to hear and to listen to the person in front of you, there's an authenticity that it blooms, right? And that when we are talking to someone, we're in the presence of someone who's really being authentic. Excuse me. We can't believe it. We're blown away. It's you're so attracted to it, and that to me is something caught in my throat, is so so healing in and of itself.
So I'm going to play devil's advocate a little bit, right? So what you're saying, and what I absolutely agree with, is we have to show up, we have to provide some space, we might have to put other things on the back burner, but really, you said it will almost force upon someone to figure out why they do the work that they do. So someone could think about this and say, okay, well, you know what, then I'm out. If I just don't ask the questions that allude to trauma or what's happening, then the can of worms just will never get open. I'll continue to practice medicine and we'll go on about our business. What's the risk there?
Well, I mean, I think obviously the risk is that you'll be able to provide a Band-Aid, and you're not, the opportunity to get to the core of what is going on will be lost. It's kind of akin to, when someone comes into your office and who's might be addicted to whatever particular substance, and you can help that person maybe manage that substance, as opposed to finding out why they're utilizing the substance in the first place. So I think that that's kind of what's going to happen. And truth be told, a lot of therapists and a lot of clinicians work on that assumption. And the other thing here too is people who have difficulties, who have challenges, will not open up to you. They will sense that you're not going to be able to handle what's really going on for them.
That's so important. I had this supervisor when I was a graduate student, and she said that being in a space with someone is like preparing for a picnic. And if you throw out a blanket, but then get out your best crystal and silver and stemware, basically what you're saying to the person is, I'm not ready for you, only on my terms.
Right.
And I love what you just said. They will sense that.
Right.
That's really profound. So when I listen to your podcast, I hear a common theme from you. You kind of alluded to it a little bit ago, and from your guests, about sharing stories. Can you say more about this?
Well, yeah. I mean, I think there's something about a story that, for me, that is very personal. And I think we learn about ourselves through stories. We learn about each other through stories. And it invites us to be who we are, if we're really honest. I mean, for me, this is what is exciting to me about everything we're talking about. It's the willing look. Everyone, whether you're a therapist or you're a doctor, physician, whatever, we all go to school, we all get the education, but it's the ability for that person to communicate themselves. I'm not saying you again have to share openly, but the ability for us to connect with each other through our own experiences, even glimmers and glimpses of those experiences, creates an understanding that we're on this earth together. Look, inherent in everything we're talking about is a dynamic, right? There's a therapist clinician dynamic, and the patient's kind of down here. And part of the work, I believe, is kind of leveling out that. And this can often be done very unconsciously, kind of behind the scenes. And when it's effective, it allows for that relationship to happen. And once that relationship happens, that's kind of the foundation for healing, whatever you're talking about.
Oh my gosh. There's so much that you said that I love, right? Like, it allows us to be who we are. It allows us to have a shared experience. What would you say to a young professional, or even a seasoned professional who maybe who's like, okay, I kind of bought in now. I understand why it might be important to ask some of the tough questions and sit in this space, but like, I'm scared to put that out there to create this space. How would you respond to that?
Right. And I think, well, first of all, I think I would say good. I mean, that's kind of a healthy look, I think it's really easy for me, when we're talking about trauma, to kind of just whip it off. Again, and especially when I think we're talking about interpersonal trauma and abuse, to me, there's nothing more horrendous and horrific. And to be talking about it is really scary. And I would say that is a good indication that you're feeling, and there's nothing wrong with that. But I would also say that there are ways to learn to manage that and to deal with that and to work with that. And that doesn't always mean that you can't express some of that when you're talking to someone. I mean, I oftentimes, when I'm interviewing someone and they're telling me this crazy stuff, I'm like, damn, really? I mean, we are human beings. And again, right, we have to be mindful of how we're responding when we're doing it, for whose interest this is. But we can't be afraid to let our human beingness show.
Yes.
And that fear, I think, is a good indication that you're feeling. Okay, so what does that mean? Maybe that means you need to get more education. Maybe that means you need to work on your own stuff.
Yes.
A lot of things. But I would say that there's nothing wrong with that.
So I appreciate a lot of what you said, right? Fear is good. It may increase our awareness, but mostly you're responding with humanity. And I just want to say, like, even as I heard your voice say, man, are you kidding me? When you hear another human being's pain or experience, what I want people to know is that might be the first time anybody has said to them,
right.
Wow, really?
Right.
Tell me more.
Right. Exactly.
I can tolerate this. And I think there's nothing more beautiful we can do for another human being.
I agree, and oftentimes, especially when you're walking into a professional's office, oftentimes you're not expecting that. You're expecting anything but that. You might even be expecting not to be believed. But to be able to express yourself, to be able to be vulnerable, and again, I'm not saying abandon all your knowledge and stuff like that. I want to be, I could see people taking this the wrong way, but I'm saying there's a human beingness that happens when we allow our guard down just a little bit. And it opens up this communication channel, this feeling channel that to me is vital. One of my guests said, I was talking to them, and I told her, because look, when I first got out of graduate school, believe me, I was not like this at all. I was anything but this. I got my degree. I have all this knowledge. I want to share it. I want to utilize it. I want to help. I want to help.
Right.
And this guest said to me, how dare you think that is your job to take away someone else's pain?
Wow.
Their story, they have their own story. They have their own healing journey that started long before they walked into your office.
Yes.
And that really opened my eyes to what it means to be with someone and to sit with someone and to witness, and how powerful that is.
Oh my gosh. Yeah. That feeling like I have a right to my story.
Right.
Yeah. Other things you would want people to know in this field of medicine?
That's enough.
So good. Okay. I have 4 really quick rapid fire questions for you.
Yeah.
What's one thing that you think people get wrong about therapists or mental health professionals?
Wow, that's a tough one. Well, one thing they get wrong, I think, that therapists, like, I think, generally speaking, when someone is reaching out to a therapist, they might reach out to that person and it might not be a good fit. And then that's it. All therapists are different.
Yeah.
And I think that if you're looking for a therapist, there's a good fit for you out there. Don't stop until you find it.
So good. Yeah. So if you're a patient listening, or if you're even a physician listening who may be seeking out therapy, keep looking until you find your best match.
Definitely, because it's
Agreed.
out there. The
Agreed.
person is out there.
You alluded to this maybe a minute ago, but I want to ask again. If you got to go back and tell young Guy Macpherson some professional advice, what would you tell him?
Yeah, this is a good one. And I would say honor who you are, trust that your own experiences, the peaks and valleys of those, your own traumas, your own the different facets of yourself, trust that all of that is so vital in the healing process. It's part of you as a therapist, as a clinician. It's not just your knowledge, which is so important, but all the different people out there who are listening to this, all the different therapists and clinicians, they, the common denominator to a certain degree is the knowledge. But what differentiates each of them is their ability to be themselves and to be a human being, and that's where the power in doing this work is.
Oh my gosh.
And I think a lot of times people, they don't value that. And I certainly didn't.
Right.
I didn't. What do you mean? I went to therapy. What do you mean what do you mean that I have to work on myself? What about all this other stuff, all this knowledge and all? That's what I need to jam into my head. What about all that? Yes, it is. But that's not necessarily what's going to be communicating and needed when you're working with someone.
I mean, you just said it, right? We all pass licenses and boards and all that kind of stuff that says, okay, you have the pre-required skill sets to practice. What differentiates you is that human beingness that you were talking about. Okay. So on that note, that human beingness, will you share one thing about yourself that makes you a messy human?
A messy human. Oh God. Well, I guess you have to I'll define messy how I will. A messy human being. I mean, I get anxious a lot. That's my messiness. That's a huge question. We can go, that's another episode. I'll leave it at that.
That's good. People asking you questions like that. Okay, last one. It's 11 o'clock at night and you have a food craving. What do you reach for?
This is a great one. Ben and Jerry's New York Super Fudge Chunk.
Wow, that was specific. Okay, and then lastly, and importantly to me, if people want to learn more from you, learn about how to work with you, where do they find, what can they do? What ways do they do that?
Yeah, I mean, I think the easiest way is just my website, the Trauma Therapist Project, or the traumatherapistpodcast.com.
Awesome.
Take you right there. Yep.
Awesome. Thank you so much. Thank you for joining me. This is really wonderful.
You're welcome. This is great. Thank you so much.
Absolutely.